Mary with Premier. Just because I've been doing skin for 24 years doesn't mean that I'm exempt from dealing with the same issues that everyone else. And skin issues really affected my self-confidence. The period of time for 5 years that I broke out in my mid-20s, that was horrible. I mean, I battled breakouts and had to do a treatment every week and wanted to hide my face. It affected my social life, my professional life. I mean, I canceled a date because of the excessive breakouts. And it affects you in so many ways that you don't realize and breaks down your self-confidence. I started to have a really bad self-image, especially afterwards when I had all the scarring left behind from the cysts. So it's called ice pick scarring. I'll let you in on a couple secrets that I've been using that I really see a huge difference with my skin. I have no Botox or fillers, 44, and I was starting to get the 11s in my glabella, which between the eyebrows, the lines, and then the scarring. I had somebody actually tell me, "Oh, I love your dimples." They're not dimples. I had scarring, a pitted scarring on my face. So it's rather embarrassing. I started using DNA pads, which I love. The growth factor, vitamin A derivative, like retinol type. There's several different types. This is non-aggressive, and peptides. It's a little pad. I just wipe my face down and then leave it on. And I do that at nighttime. I also do DP4 microneedling, which this has saved my life. I did a treatment 2 days ago and I have no downtime. Now I do get a little more aggressive with mine. You might see a little bit of flakiness in my cheeks and in my glabella because I do my whole face for facial rejuvenation. And then I go back over and I focus on the areas where I really want the biggest difference. Now, doing stuff at home is important because I don't think I would have got the results that I did with the DP4 had I not been speeding up that cell rejuvenation, cell turnover. And by increasing your cell turnover, it's the anti-aging, okay? You're fighting premature aging. I also, when I do DP4, I don't do just with the Hyla Active. I use one of the MG collection or the Exosomes. Exosomes are naturally in your skin. It's released from your RNA, tells your skin to reproduce new healthy cells, and it really works. Specifically RAS from the MG line is good for retexture, smooth texture, and it helps with my scars and the deep lines that we're starting. But there's several different ones to choose from, and through looking at someone's skin, I can tell what the best combination is for each person. And that's one way that I customize my DP4s when I'm practicing. As your clinician, I sit and listen to what specifically you want changed with your skin and try to work on that, because I know how bad it impacts your self-image and your self-esteem. I mean, it broke me down a lot, especially with the scarring. And I practice skin. I want to be a representative of my work. And if I can't take care of my own skin, how am I going to take care of everyone else's? So this is all going on in my mind. I can only imagine, everyone else that doesn't have all this equipment and stuff at their fingertips. So a couple more tips. I can prep the skin with something called a permafuse. It's 100% active ingredients, and it penetrates the skin within 3 seconds. And it's a great exfoliator and prep for doing the DP4. Also a treatment on its own. But there's a lot of other things that can be done, and I'm all about customizing. Everything needs to be done specifically for the individual type of skin, the goals you're trying to achieve, the budget you need to fit it into. So check out the website, premierfaceandbodywork.com, or text or call 407-592-9422.